What are the symptoms of COVID-19? The first part of this block is going to list the symptoms associated with COVID-19 that shouldn't scare anyone, but the last bit will be all about the more dangerous aspects of the disease. Don't be alarmed, as these are the worst-case symptoms that won't affect most people who are infected. The most common symptoms of COVID-19 are fever, coughing, and shortness of breath. These are the same symptoms most people get from the common cold, but they are the mildest possible symptoms a person can experience. For those who are under a greater deal of risk due to a compromised immune system, or meet the criteria previously mentioned, symptoms can become far more severe. COVID-19 can increase the chances of contracting pneumonia. It can cause multiple organ failure, and in some cases, it can result in death. These are the most severe cases, though all are of concern due to the ease by which it can be transmitted from person to person. COVID-19 mortality concerns. Yes, COVID-19 can end a person's life, but that doesn't mean the world will end up like it did in Stephen King's The Stand. The mortality rate for COVID-19 is estimated to be 2.3%, and while that number may seem low, it's not. If you compare the mortality rate of COVID-19 to something more common like the flu, it's considerably higher. The flu has a mortality rate of 0.1%, which sees an average of 1 death per 1,000 people. These numbers are determined via the case fatality rate, CFR, which compares the total number of infected patients with those who succumbed from the disease. While COVID-19 is much higher than the flu, it presents as a mild infection in the vast majority of people who have had it. The majority of people who have died in China have been elderly, and studies of deaths from the virus show that the CFR jumps to 14.8% for people who are 80 and older, while those between the ages of 70 and 79 have a CFR of 8%. For people who were already critically ill when they came in contact with the virus, that number jumps to 49%, suggesting they are the most vulnerable members of the population. Avoid becoming infected. There are steps you can take to avoid becoming infected, and chances are, you've been doing them all along. Because COVID-19 is a coronavirus, which is passed in much the same way as a common cold, the best way to keep from getting it is to wash your hands with soap and warm water. Avoid touching your face after coming into contact with anything commonly used like doorknobs, and if you have to go outside, try to avoid sick people. 17. Odds are, you do all of that already, so you don't have to let COVID-19 upend your life or your routine. If you have concerns about winding up in a place with a lot of potentially infected people, you can avoid traveling and going to events with crowds, but that may not be necessary. If it makes you feel better to wear a face mask, you can do so, but make sure you get the right kind. The U.S. Food and Drug Administration recognizes 4 off-the-shelf N95 respirators, which may be effective in stopping the spread of COVID-19. 3M trademark particulate respirator 8670F. 3M trademark particulate respirator 8612F. Pasteur trademarked F550G respirator, and the Pasteur trademark A520G respirator. These respirators are not suitable for children or men with facial hair. COVID-19, HIV, and other conspiracy theories. One of the reasons there are so many conspiracy theories about viruses like COVID-19 is that few people truly understand it. Hopefully, this list will help with that. But there are people who hear a comment like, "This virus may use the packing mechanisms of other viruses such as HIV," and their imaginations tend to run wild. That finding was published by scientists at Nankai University, and it's true. The virus does have an HIV-like mutation, but that doesn't mean someone weaponized a form of HIV in a lab somewhere and released it upon the world, as some conspiracy theories have stated. These same mechanisms appear in many diseases as the result of natural mutations. That remark has everything to do with the means of fighting the spread of infection, and research like this helps push further research, which could hopefully lead to a cure or vaccine. You may have seen other conspiracy theories, including one about a new 5G wireless infrastructure being the cause of the disease, but this is so ridiculously false, it barely deserves mention. The most important thing to do when it comes to hearing these stories is, ask yourself if they make sense, see if they are published by reputable sources, and take a common-sense approach to anything you hear. What to do if you think you're infected with COVID-19. The very first thing you need to do is remember the words printed on the cover of The Hitchhiker's Guide to the Galaxy, which are "Don't panic." Panicking doesn't help you or your loved ones, so you need to take care of yourself to ensure you don't spread the infection and make sure you get the proper care. If you develop a fever along with symptoms of respiratory illness, you should call your healthcare provider and ask for their advice. They will know the right questions to ask to help determine if you've got the common cold, or if you have something more serious. If you fear you truly did come in contact with someone infected with COVID-19 and are concerned you may have it as well, you need to get tested. Because you are leaving the house to get checked, be responsible, and keep your mouth and nose covered. This will keep you from passing the virus to other people, so if you have a respirator or surgical mask you can use, do so. If not, you can use a scarf or similar article of clothing. Your local hospital may not yet be equipped with testing kits for COVID-19, so call your local public health department for information on the best place to go.